Well, finally, we now know why some people have a sweet tooth while others can skip dessert without a second thought, really. According to a new study conducted by the Monell and Berghofer Research Institute, a gene makes, right, isn't everything about genes,
yes.
Heather? A gene makes some people crave sweets more than others, and as a result, some people may need an extra teaspoon of sugar in their coffee to get that same sweet punch.
Joining us now is our chief health editor, Dr. Nandi. Dr. Nandi, this is really interesting. Does this make us look at sugar in a whole new light?
It helps me a lot because I have that gene. I'm sure
yeah.
of it. I definitely have that gene. Well, you know, you feel not as bad because you're eating all the stuff that you like. It just shows that maybe some genetic basis to it. It doesn't mean it's an excuse to go and eat 10 candy bars because I can't help it. I've got the gene. You know, so you have to have some control.
Are there things that people can do with a sweet tooth, you think, to present them,
Absolutely.
you know, or to prevent from blowing a somewhat healthy diet?
It's like anything else in life, right? There are things you like, things you don't like, so you have to have a plan. So I said, have a plan, and then say you're going to have one candy bar every couple of days instead of 4 of them. If you're going to have, you know, sugar in your coffee, don't have 5 cups. No, you don't have 5 teaspoons. Have 1. And also work with your doctor or your dietitian to see, listen, are there some sweets that are better? And so that's what I would do.
Hey, I do find it interesting, I just want to say, because like you guys both said you have more of a sweet tooth. I like more of the chips and the salty stuff, so it really does make sense. Oh, you have them all.
I have the salty, the fatty foods, and the sweet food gene.
Got it.
All of them.
All right.
Are there some sweets, though, that are slightly better than others?
That's a great question. Absolutely. I think all fruits.
Hopefully chocolate. You're going
to unfortunately. Once in a while it's good. But, for example, cherries are great because they have a low glycemic index. What that means in English is that it's a better sweet for you. Most fruits have that. So if you want to have a milkshake, get a smoothie instead. And so if you have that kind of plan, I think you can still satisfy your sweet tooth and be healthier.
Yeah, sounds good.
All right, well, let's move on to our next topic. The Oakland County Sheriff is calling on doctors to monitor their patients' prescriptions, especially when it comes to painkillers. Now, Michigan has an online system called MAPS, and doctors can use it to enter their patients' prescriptions, but it's not mandatory. The Sheriff's Department wants to change that and says if doctors enter their patients' prescriptions into the system, other healthcare providers can see what they've been prescribed and when. So is this a good idea?
I love it. I love this idea because here's the thing, you know, we have, let's say my patients could see 10 doctors, and it's hard for me to communicate with each doctor, right? So if we put it in the system, there's some uniformity. So Dr. Smith can see, oh, Dr. Nandi wrote a prescription for a pain medication. You know, the patient, we need to talk to them and see if they have a problem. So I love it. I think it's an absolute necessity.
Yeah, because you can literally doctor shop and you can pharmacy shop, right? So you could have 10 different pharmacies, doctors, and all that. Have you used this MAP system before?
I definitely have. I have. My staff has. So and you get an inkling sometimes of patients, and even if you don't, you should check. But some patients, you know, they're asking you for pain medications, you know, far quicker than you think they should. You go to MAPS and you find out, well, they took a medicine 10 days ago and they prescribed by another doctor. What I do is then have them come in. I don't make it punitive. I said, let's come in. Let's talk about the fact that prescription drug use is one of the biggest problems in America, and how can we solve it? So I think it's a great idea, and I think if all of us, you know, get in line with it, I think it'll help a lot.
But it's just doctors that can access it, right? There's not a privacy issue with other people
No, it should not be. No, it's doctors and pharmacists, too. Pharmacists as well, but I think it's important for them to know as well.
Of course.
All right, speaking of prescriptions now, growing number, this is really fascinating here, of doctors are actually writing out scripts for patients to buy fresh produce. This is a new program that allows doctors to prescribe fresh produce for low-income patients with chronic health conditions like diabetes or heart disease. The prescription also comes with $100 worth of vouchers for the patient to buy fresh food. It seems like a great way to help people eat healthier.
I love it. You know, here's the thing. When you get a prescription, something happens, right? It's like, it's not just me talking to you, but it's a piece of paper with it's always like a medication. And I think that food is medicine. I tell all my patients that, you know, you ask me about the side effects of the medicine, but the food that we take, if we put it in a prescription, I think it helps a lot. I think it also gives you some direction on what to do. And then the $100 for some people could be huge, because sometimes, let's face it, it's not always cheap to eat healthy.
It's not.
But it's cheaper for your health overall. So I love that idea.
But it's not an actual prescription where you're going to take it to the pharmacy and get carrots. This is like telling the patient in writing, this is what you need to do, and here are some vouchers, especially in some urban areas where it's a little more challenging to get the fresh
Exactly.
produce.
You know, for sometimes I do procedures, I write down for the husband, say, you know what, your wife cannot have any household duties for a month. I give them a prescription, and that's an order they love. But you know, seriously, if you give them a prescription, they at least feel like they should carry it out. And then you get the vouchers. And then here's the thing about fresh food. We're talking about fresh food versus processed foods, right?
Right.
When it's processed foods, you have no idea what they put in. They could put added sugar, salt, who knows. But if it's fresh food, you have to decide what goes in, and hopefully you'll make some of the good choices. But at least you know what's in it. So that's why I love it. Because if you have fresh foods without preservative and sugar, you usually have a healthier diet.
Yep.
That's why I love it.
Dr. Nandi, thank you so much.
Thank you.